Hello, everyone. My name is Dr. Kundlas, and I'm a primary care physician. There is not a day I do not get a call, or when I see the patients, they ask me how can they stop medications. On an average, if you age 65 and above, you're taking 3 to 7 pills. Between 40 to 64, average is 2 to 4, and if you're less than 40, there are about 2 to 3 pills. They have side effects, they lead to sick roll. We don't feel good about taking medications. It is a constant mental fight which we all are living through on a daily basis. The truth lies somewhere else. When patients come to us, they already have gone through journey of life, and their personal choices, habits have led to chronic diseases and many time complications. And we catch this thing at a very tail end of this process. None of us is born with a manual how to live good. I am trying to simplify the complex healthcare information. We incorporate the questions which are asked on daily basis, and we convert them into a process so that we could understand them and eventually lead to a presentation so that we could help a wider audience. I have personal experience that I have to take few medications recently, and it was not very easy. I was very hesitant, reluctant. I did everything not to take the medication. That was an eye opener. But what we need to do here is we need to ensure that we do not leave the perspective. Why do we take medication? We are taking medication for a problem, trying to prevent complications so you live full longevity of life. Let's try to simplify this question: how I can cut down my medications, or how I can completely stop the medications. If we want to understand that, we need to understand where we are, what are the changes we could do, and how we could reverse engineer everything to either decrease the medications or to stop the medications completely. And that starts very early in life. We all are hero of life, and we make choices that has consequences. And none of us come to this world with a manual was healthy living it. Our social environment changes, our financial environment changes, and in this changing environment, we are trying to play with the older roots to make them understand who they are, how they can understand themselves and their family members to make good choices. We need to demystify at a fundamental level, medically, what each human being is. This is how I have interpreted myself, and I have been able to recognize that each human being has 5 domains. You all can feel your body. Most of us know ourselves through the body. This body has a brain which has emotions and feelings. We feel good, bad, ugly through this. We have thoughts or an intellect, the critical analyzer sitting in your brain who tells this is right, that's wrong, we should do this that way. And that is your intellect. Fourth thing, you have your personal code of conduct. It can come from anywhere. It could come from our religion, religious practices, our social environment, or our personal code of ethics, which we call spiritual domain. So far, 4 things are in each individual: your body, your emotions and feelings, your intellect, and your personal GPS. There are 4 domains which are inherent. We all live in this world, which we call social environment. This social environment is made up of 5 things. There are other peoples, other things, events, time, and places. We have to navigate our life through 5 domains, and that is a main problem. Places where we live, things where we are, that affects us. Then what are the things in our environment going on that affects us? What are the events in our environment that affects us? Then the time. What stage of life where we are? When we are young, we do differently. When we are old, we look at the things differently. It has been a constant struggle. 5 domains of ourself have different needs. Our body need to eat, need to rest, need to move, and need to sleep. Now the question, that's where the personal choices comes in. Body doesn't tell us whether we eat healthy food or unhealthy food. Body gives us hunger. It is up to us to make choice what kind of things which we do. Second is the rest. Third is the sleep. Fourth is movement. I didn't say exercise. Our body is not made to exercise. We should exercise, but our body is not designed to exercise. We could move in the house where we safely know our environment. I think if we start moving, that will help. And we make wrong choices in our physical domain which pertain to our body regarding eating, rest, movements, and sleep. And we lead to a whole host of complications. Second domain of our life, as I explained, is our emotions and feelings. In that domain, we want to feel pleasant. What we want that everything should be calm and collected. If we are not able to accomplish that, we try to fill those gaps either with binge watching TVs, videos, smoking, drinking, drugs. We are trying to satisfy on different spectrum our emotional needs. Third domain is your intellect. That needs stimulation. We don't think. We are just driven by our devices and also driven by our impulses, and we are not thinking. Next is the spiritual domain. Spiritual domain is dying away. If religion or our spiritual practices provided us something that was a constant way we acted and reacted, we were provided certain do's and don'ts, which was helpful to make choices. Then our social environment. So what the message which I'm trying to tie up is we all are hero of our life. And this hero has a physical needs and demands, emotional needs and demand, intellectual, spiritual, and social. And nobody tells him what needs to be done. And he or she is trying to figure out, which takes time to understand this world. We are making wrong choices. By the time a human being matures and understands what is good for them, it is too late. We have already become lethargic. We have gained weight. We make poor dietary choices. And then we are totally not comfortable in our skin. We are stressed. The chronic risk factors are obesity, lack of exercise, extra stress, smoking, and drinking. These risk factors pretty much lead to about 80 to 90% of chronic medical problems, whether it's high blood pressure, diabetes, high cholesterol, or COPD, heart attack, stroke, heart failure. Everything is tied down to our risk factors. We have already developed these risk factors leading to multiple complications. So if we want to stop medications or decrease medications, we have to reverse engineer everything, meaning we must reverse our risk factors so that our diseases start getting better. I have hundreds of patients who were diabetic. They understood it, changed their diet, started exercising, stopped smoking, and they are able to come off the medication. This body is very honest. You do good to it, it has a lot of reserve, it improves. You may not be able to stop all the medications. If you are honest with yourself, you will be able to prevent all chronic risk factors and medical problems. That is the biggest two concepts. Number one is your risk factors. Second, choices which we make. If you look at it, chronic risk factors or chronic diseases in our society are high blood pressure, diabetes, smoking, and obesity. Those four things constitute about 70 to 80% of all medical problems. If we just correct that, we will be able to cut down the burden. In the United States, we spend about 15 to 17% of total GDP on healthcare, and 80% of that goes to chronic disease management or complications. There is not enough funding for prevention. Our system was designed at a time where our risk factor and daily habits were very prudent, and system never figured it out that there should be any funding or awareness programs or anything which needs to be done to prevent this chronic risk factor leading to chronic diseases and complications. That led to a system which is not geared toward prevention. We have multiple partners in their healthcare system who survive and thrive only on to keep you sick, keep you misinformed, keep you scared. My attempt in this video is that if I could make you understand your own physical needs, emotional needs, intellectual needs, spiritual needs, and your social domain, which is made of people, places, things, time, and events, you will be able to reverse engineer. So in a nutshell, I want to bring it to your attention. We all are hero of our journey in life. We learn things as we go along, and we make choices which are not conducive to long-term health. Controlling our risk factors will lead to better health. We will be able to lower number of medications or completely stop. We have this YouTube channel, Kundlas MD. I request if you could subscribe. That kind of keeps us motivated to continue to produce more content. Thank you very much.